All right, good afternoon, everyone. I think we're slightly behind time, so if you want to join this session, if you could take your seats, that would be fantastic. I hope everyone had a good lunch and enjoyed the first morning of the forum. Now we're going to move to our second lot of sessions, and this one is on system-wide assessments and reform. And we have a very packed session with 5 presentations. First we're going to hear from Asen Du from the Philippine Statistics Authority. Asen, he has a background in policy development, process mapping, and system specification. He currently works with the Philippine Identification System as a registration officer, focusing on enhancing civil registration processes through integration with national ID systems. His work involves policy development, process mapping, and system specification, with the goal of improving registration completeness, data accuracy, and inclusivity, especially for marginalized populations. Asen specializes in integrating national identification systems with civil registration, aiming to strengthen data quality, inclusivity, and operational efficiency in line with SDG 16.9, which I'm sure you all know is the SDG on legal identity for all. After that, we'll hear from Mr. Stephen Bungingo from the National Identification Agency of Rwanda. Stephen is an accomplished professional with a Master of Business Administration and certifications in PMP and Prince 2. With over a decade at the National Identification Agency of Rwanda, he's led CRVS capacity building and played a pivotal role as liaison with development partners during the CRVS digitalization project. He currently heads CRVS capacity building initiatives in the Office of the Director General, driving innovation and sustainable systems. Following that, we're going to have 2 presenters from Indonesia, Mr. Ariando Septian and Mr. Haryo Pambudi, both of them from Puskapa University. Ariando is a researcher specializing in inclusive development with a focus on vulnerable populations, particularly persons with disabilities and persons affected by leprosy since 2011. Since 2015, his research has focused on examining barriers to accessing basic services, especially legal identity and civil registration documents. Now, as the county coordinator for the CRVS program in Indonesia under Vital Strategies, he works closely with the government and partners to strengthen CRVS systems through policy reform, interoperability, improved data use to support evidence-based decision-making, and to ensure that no one is left behind. And with him is Haryo, who is a researcher and policy advocate interested in child protection and governance reform issues. With Puskapa, he is actively engaged in the policy-making process with the government of Indonesia to improve the CRVS system so that it can be inclusively accessed by all society and vulnerable groups. After that, we're going to hear from Mr. Praveen Kumar, Directorate of Economics and Statistics of the government of Bihar in India. Unfortunately, Praveen couldn't be with us today, so that will be by video. He's the Deputy Director of the Vital Statistics Section and the Deputy Chief Registrar of Births and Deaths of the Department of Economics and Statistics of the government of Bihar. He's responsible for implementing and managing the CRVS system in all 38 districts of Bihar, as well as monitoring the progress of birth and death registration in the state, and provides supportive supervision to all the district statistical officers. And finally, we're going to hear from Dr. Mariam Sarfraz from the Health Services Academy in Pakistan. She is a public health academic and policy expert with over 15 years of experience advancing sexual and reproductive health, health policy, economics, and health system strengthening in Pakistan. She holds a PhD in public health and has an extensive portfolio of peer-reviewed research. Currently, she serves as a professor and dean of the Faculty of Midwifery and Nursing at the Health Services Academy and has recently held senior leadership roles at the Ministry of National Health Services. Dr. Sarfaz has led several national and international initiatives with UNFPA, UNICEF, WHO, and the Gates Foundation, including National Health and Population Policy, operational research for EMONC, Emergency Obstetric and Neonatal Care? Yes. And child health, midwifery education reforms, SDG 3 localization, and implementation research to improve maternal, newborn, and reproductive health outcomes. So we have a very distinguished panel with us today, looking at many different aspects of CRVS systems and inclusivity, and how to improve those systems. Just a reminder, this is the conference room with interpretation. So to enable effective interpretation, English to French and vice versa, please do speak slowly to help the interpreters. And with that, we can start off with our first presentation from Asindu, which is Enhancing CRVS Data Quality and Inclusivity Through Integration. Where's Asin? At the very end. Over to you.
Hello. Good afternoon. Today I will present my research entitled Enhancing CRVS Data Quality and Inclusivity Through Integration with PhilSys. This study examines how the Philippine National Identification System can support improvements in civil registration and identity verification processes. The analysis focused on early implementation experiences in selected local government units in the Philippines. Next slide. How to use
Slide changer. This.
So why CRVS matters? Civil registration and vital statistics systems, or CRVS, are fundamental components of public administration. They provide legal identity for individuals and generate reliable vital statistics used for governance, planning, and service delivery. A strong CRVS system is also essential for achieving Sustainable Development Goal 16.9, which aims to ensure legal identity for all. However, many countries still face challenges in ensuring complete, accurate, and timely civil registration. A strong CRVS system is also essential for achieving, however, sorry. So we have challenges in the Philippines CRVS system. Despite significant progress in civil registration coverage in the Philippines, several operational challenges remain. This includes delayed or incomplete registrations, as well as duplicate records and inconsistencies in demographic data. Certain populations remain particularly vulnerable to exclusion, including those living in geographically isolated areas, indigenous communities, and low-income households. These challenges can affect data quality, administrative efficiency, and access to public services. At the same time, the Philippines has implemented a national digital identification system called PhilSys. As of October 2025, over 90 million Filipinos, or approximately 80% of the population, have been registered. Each registered individual receives a unique PhilSys number, or PSN, supported by biometric deduplication mechanisms. This creates an opportunity to strengthen identity verification processes within civil registration workflows. So the objective of this study is to examine the early implementation of CRVS PhilSys integration and identify operational insights from these experiences. Specifically, the study aims to identify operational insights related to identity verification, workflow coordination, and improvements in data quality. Rather than conducting a quantitative impact evaluation, the study focuses on documented implementation experiences and operational practices. This study uses a qualitative documentary analysis. Instead of collecting primary data, we reviewed PSA policies, issuances, and official implementation reports from 2024 to 2025. The analysis focuses on early integration experiences in 3 local government units: Tublay, Tuba, and Maasin City. This analysis draws an official publication from the Philippine Statistics Authority describing integration activities in selected local government units. These include Tublay in Benguet, Tuba in Benguet, and Maasin City in southern Leyte. These cases integration involves incorporating PhilSys authentication mechanisms into civil registration transactions, including document requests and identity verification processes. This table summarizes the key features documented in these LGUs. This figure illustrates how PhilSys authentication can be embedded within existing CRVS workflows. Traditionally, identity verification relies heavily on manual document checks and supporting documents. With integration, applicants can present their PSN number or PhilSys number, allowing authentication through the PhilSys system. This introduces a structured verification step before record processing and document issuance. Based on the reviewed documentation, the integration process follows a stepwise verification approach. First, a transaction requiring identity verification is identified. Second, the applicant presents or retrieves their PhilSys number. Third, authentication is performed through the PhilSys system. This is followed by cross-checking demographic information, confirming the identity, and continuing with the civil registration process. The documentation suggests several operational observations associated with integration. First, identity verification process become more structured through PSN-based authentication. Second, there is reduced reliance on purely manual documentary verification. Third, integration requires a strong coordination between PSA offices and local civil registrars. Finally, clients are increasingly guided on the use of digital national ID credentials. For the discussion, the findings suggest that PhilSys integration strengthens identity verification within existing CRVS processes. Instead of replacing CRVS systems, PhilSys authentication is embedded into the identity verification stage. This introduces a more structured way to confirm identity and help support record linkage across systems. For governance and practical implications, the early implementation experiences highlight several governance and operational considerations for scaling the integration. These include coordination between PhilSys units and local civil registrars, standardized operating procedures for authentication, and continued capacity building for local personnel. Strong data privacy safeguards and monitoring system will also be important to ensure secure and effective implementation. And for the conclusions, integrating PhilSys into CRVS workflows that has the potential to strengthen identity verification processes. The early implementation experiences in selected LGU demonstrate that this integration is operationally feasible. However, successful scaling will require continued capacity building, institutional coordination, and monitoring mechanisms. Overall, these efforts support the strengthening of legal identity systems and contribute to progress toward SDG 16.9 on legal identity for all. Thank you.
Thank you so much, Ace, and I'm always blown away by the fantastic work coming out of the Philippines, especially in this area. We do have a few minutes for questions. What I would suggest is we've got time at the end for questions to the panel as well. So if you have any questions to Asen about his presentation or his work, anything that you would like to just clarify or follow up on, then please do. We have a few minutes now. Otherwise, we can have broader questions for a discussion at the end. So would anyone like to ask a question to Asen on his presentation or his research? Yeah, Jackson, please.
Quite an interesting presentation in the authentication of identity. I was so curious about the delayed and incomplete registrations in some of your challenges in Philippines. Could you further elaborate on some of those challenges that delays registration in the Philippines? Thank you, in your presentation.
Actually, we have delayed registration because some of our countrymen in the Philippines is in the far away location, like we have the indigenous people in in some provinces, so they can't register their birth, even their death, because they don't have the capacity or the means to register their birth because they are far away from the local government unit of their area. So that is one of the problems that we are facing right now in the Philippines. So, yeah.
Would you be asking?
Hello?
Would you be asking in French?
In French.
Okay, so if you want to understand the question, you might want to use for those.
Can I speak? Thank you for this presentation. I wanted to know, to this day, can you give us an idea of the registration, birth and death in the Philippines? The level, the rate. The birth and death rate in the Philippines today.
Yeah, sure. I can.
Okay, thank you.
Yeah. Actually, he's asking the rate of birth and death now they are currently in the Philippines. Can you get me?
What is the rate? What is the current rate? Is it the completeness? So Asen, he's asking what is the completeness of birth and death registration in the Philippines?
Actually, this is my research is about the qualitative. This is a qualitative research, so I don't have the data about the death rate or the data for that. So right now I'm trying to coordinate with our statistics unit in the PSAs for the data. So actually I want to see the data for that. So I'll just get back to you if I have those data. Thank you.
My question in French. I want to know, is there some system, interoperability system and at the different level, different national, in the health system and in other system? Is there any, so that is the first question. At the system level, is there some database that we use when we have some identification system? And at the country level, at what level is this database localized? Is it at the National Institute, Statistic National Institute, or is it located at the National Civil Registration? Where is it located? Thank you.
Right now, this research is mainly focused on the integration with the PhilSys in the local government unit of the Philippines. So I already asked our officials in the PSA, in the Philippine Statistics Authority, if we have a national level implementation of the system. We already did have a national level implementation, but it's on pilot. It's just a pilot. We're just testing the system to our national database in the PSA. So maybe if we are fully equipped with the full implementation, we are going to 100% implementation of this integration with the national ID? Thank you.
Thank you, Asen. So we will have time, if you do have any more questions at the end, for further questions to the panel. But in the interest of time, we probably should move on now to our next presentation. And we are going to travel halfway across the world now to Rwanda. And the next presentation is Innovative Solutions and Best Practices in the Transformation of Rwanda's CRVS System. So Stephen, over to you.
Thank you.
Thank you. So I first want to acknowledge the work that is being done by UNESCO and UNECA, and also to acknowledge the contribution of Aline Kabagenyi, and also especially extend my sincere thanks to Ms. Lillian and Mosidi for their contribution to this work. CRVS systems are sources of data that are used for governance and provides timely data for public health development. And we've been in the process of modernizing civil registration system since 2016 in Rwanda. We understand that partnerships have been playing a great role in having our system the way it is today. But one asks why the topic on innovative solutions and best practices in the transformation of Rwanda's CRVS system, with a specific emphasis on the review of strategic partnerships. So, well, the topic came as a proposal from our Director General in 2013, where we had received around 10 delegations from different countries that had come for study tours. But at the end of every one of those presentations, they ended up asking us about the literature, about what we had presented, and we didn't have that. And therefore, that's where the idea came from, to document the practices and the process that we've been engaging in improving CRVS system. So there was a knowledge gap and a literature gap. So as I was trying to figure out how to put together notes on the civil registration improvement process, that's when the CAT initiative came in, and I took that advantage to do this. So I reviewed different pieces of literature, specifically the UNICEF's 2020 review of CRVS innovation in Eastern and Southern Africa, which specifically looked at Ethiopia, Mozambique, Namibia, South Sudan, Uganda, Tanzania, Zambia. But this review had two omissions. One is that in the region, it omitted Rwanda. And second is that it did not tackle the role of partnerships. So you can imagine a forum that brings together people like this from different corners of the world, and it's not recognized for what it brings. It's a forum where people exchange, share ideas, and these ideas finally come up with people develop initiatives on how to develop the CRVS system. So I thought that partnerships was something that needed to come out clearly in CRVS improvement processes. The design was multi-source. I reviewed evidence from government documents, and then looked at interviews to provide context and to cross-check findings. So what I found out is that local partnerships drove CRVS transformation, and international partnerships accelerated CRVS improvement and modernization. So for local partnerships, because I was looking at local and international partnership and how this has driven improvement in civil registration. For local partnership, I found out that institutional governance structure is very important. In Rwanda, we've got governance structure that spans from high-level committees of ministerial bodies down to the local district teams. And the outcome is that this brings about strong ownership, because at each level there are specific and well-defined terms of reference for each level of governance. So with this, we find out that it brings about strong ownership and efficient decision-making and unified stakeholder alignment. So with institutional governance, every idea is aligned. And again, partnership in form of public-private partnership is also very important, because it brings about contextual design of systems. You need to understand the context under which you're working so that you are able to provide the best solution. And this again goes to the recommendations of the CRVS Improvement Framework version 2, which talks about user-centric approaches, result-oriented approaches, client-centric. So you need to design solutions that will be helpful to the local population. And again, the local development teams or solution providers are very helpful, because you are doing away with the effects of vendor lock-ins and then building sustainable systems. So again, I found out that financial partnerships are very, very crucial. The partners, local partners, provided 70% of the contribution to the project to develop civil registration, and human resources. This bringing and ensuring sustainability beyond just initial reforms. So the key finding here is that multi-sectoral approach to CRVS improvement accelerates growth. So with international partnerships, I talked about this a few minutes ago. See, the forum, like this one, the initiatives, different initiatives, like the CAT initiative, like the international meetings and conferences that we normally have been part of, and the ideas that have been generated, brilliant ideas which have shaped civil registration initiatives in different countries. This is because of the technical partnerships that emerge from these meetings and fora. And again, the financial assistance that comes with that. This was the two areas, the technical partnership and financial assistance, played a great role in shaping Rwanda's CRVS system. So the key insights is that collaboration with development partners enable effective implementation of the CRVS strategic plan. And then we also find out that the innovations and achievements in terms of legal reforms, digital CRVS system, mortality data, brought about improvements in completeness, birth registration completeness, and some steady growth or improvement in death registration improvement. And within the period 2016-2019, cause of death registration rose from 0 to 36.6%. There are challenges that remain. Death registration completeness is still low. We are looking at how to bring in innovative solutions of active death notification to make sure that the community is engaged fully. And then we are looking at future plans of adopting in fact, we have started this, adopting ICD-11 and integrating the DORIS tool in the determination of the underlying causes of deaths. So the implication for maybe CRVS practitioners is that sustainable C-level progress requires legal reforms, technology, and strong partnerships. And the major lesson is that aligned interventions with national priorities, decentralization, and investing in both infrastructure and capacity building is a result or comes with synergy that the government leadership and development partners have, and the way they collaborate in ensuring that this happens. Thank you.
Thank you so much, Stephen. And I think for me, this really shows the value of bringing together such diverse countries from across Asia and the Pacific and Africa, because I think what, Rwanda, there's a lot we could potentially learn from in terms of how you've managed to achieve so much in such a short amount of time. It's really incredible. So we still have a few minutes for questions. As before, please ask any questions that you'd like for any clarifications or points on Stephen's research or presentation, and we will have broader questions at the end. Yes, please go ahead. So this will be in French. So again, please put on the headphones if you wish to translation.
Thank you very much for this presentation. What I would like to know, in the framework of representation, you talk about partnerships to strengthen the system when it comes to the civility. You mentioned a lot about the partnership on the international level and local level. But what I have not seen in your presentation, I do not know if you answer that question. What is the place of civil societies? Where does it stand, the civil society in your partnerships? And also, how about the authority, the customary authority and the religious authority? Because as you know, these are very important in Africa in matter of advocacy. So do you engage with these actors? Did you work with them? And what's their role when it's about promoting the CRVS in your country, Rwanda? Thank you very much. Thank you very much. Okay, I got a similar question when it comes to governance. The Rwanda is named as an example every time we're talking about governance of the CRVS. I'd like to know what kind of hurdles, what kind of challenges you have encountered and you had to overcome to make sure these mechanisms were efficient, these mechanisms that you mentioned previously. What kind of issues and how did you overcome them?
Time for the questions right now. So let's go to Stephen and then see how we do for time. We can always have questions at the very end as well. Stephen.
Do we have? We had some partnerships with civil societies, of course, with some organizations, some religious organizations. In the in our partners and our partnership, the local partners, we also have civil society on board. But we do not have engaged talks with religious organizations. However, I believe that in the future, especially to have a higher level of records of data for the death certificate, this is something we should do. We should work with the religious organization, the religious leaders, before the body is disposed of, before the body is buried or soever. So we need to communicate with the religious institutions, and for that matter, I believe that that's something to do in the future. It will help us to have a better rate of death certification, to work with this religious institution. But as of nowadays, today, we did not engage yet in talks with religious leaders or religious institutions. Concerning governance, what are the challenges you have asked? So we often encounter challenges when we talk about the various partners and partnerships. Sometimes you can encounter different kind of people, different kind of partners. And what matters the most is how do we bring different people to have a common to have a common point of view and to work with the community? How do we bring people together, the different players, the different stakeholders together, and to listen to each other? That's the biggest challenge we have to face, and that we had faced in the past. And how did we overcome the challenge and reduce the gap? Well, first and foremost, all the activities that we perform in various institutions are performed in order to have a better lifestyle for the population, for the people, to improve the livelihood of the people. So we should be able to understand each other because we have a common goal. We should have a common goal, and this common goal is to serve the people of Rwanda. And this was really our motto when it came to partnerships. Over and out.
There were some more questions in the room, but we just, for the sake of time, we do need to move on. So if you can just hold the question until the end, and we'll have time for questions and answers, just to be fair to all the panelists and make sure we have enough time for everyone. Okay, so with that, we'll move to back to Asia and to Indonesia. Our next title is Towards a Connected CRVS Ecosystem, Mapping the Landscape of Emerging Interoperability Systems in Indonesia. And we have Ariando and Hareo presenting. Thank you. Over to you.
Okay. Thank you. Good afternoon, everybody. My name is Yando, and besides me is Danang. We also have one more author, that is Desta from Statistic Indonesia. I think she's in another room, but we write this down together, three of us. Desta is mainly focusing on the data, and Danang is focusing on the legal aspect of things. You can call me Yando. I work right now as the country coordinator for CRVS program in fatal strategies, and also was working with Universitas Indonesia under Puskapa together with Danang. And as you can see here, this is the map of Indonesia. If you haven't visited before, it's nearby. If you would like to visit after this, please come visit us. So as acknowledgements, we would like to acknowledge the work with Puskapa, Universitas Indonesia, and also Vital Strategies and Statistic Indonesia is one of our main contributors for this paper. We also would like to acknowledge that these studies benefit from ongoing policy dialogues also with another ministries such as Ministry of Home Affairs, Bappenas, Ministry of Planning, Ministry of Health, and Statistic Indonesia. But we will also to a disclaimer, but that this analysis and conclusion is presented remains solely the responsibility of the author. So yeah. So this is perhaps also happens in your country as well, that rapid digital expansion is happening almost in every country, but limited interoperability. So this is one of the cases that we would like to highlight in our paper. We see that Indonesia, CRVS, operates within a rapidly expanding digital ecosystem. Almost every ministry has its own digital system involving multiple platforms, and also capturing vital events. However, the data cannot flow seamlessly across sectors because the ecosystem isn't there. The regulations and many things hasn't been in place yet. So if you can see in the left side of the slides, most of the times the data interoperability is happening separately between ministries. For example, health needs to have its own MOU with civil registration. Civil registration also has to have an MOU with statistic, which made the system mission seamless. So the impact is that the data collection becomes fragmented and creates systemic redundancy and also limit vital statistic productions. So how we would like to overcome that? We would like to do the mapping first, so we know where the gap is. So we conducted structured document analysis of regulations and technical documents and implementation guidelines of 5 national data systems and develop comparative metrics to identify structural bottlenecks and integration gaps. So these are our 3 main lenses that we use to map the landscape of CRVS ecosystems. First is on the technical readiness. We would like to examine architecture, data standards, and the protocols that are already in motion in Indonesia. And we would also like to see the institutional alignment. We would like to see assessing the mandates, the leaderships, who doing what, leads what, to what ends, and the coordinations, how the coordinations done in Indonesia on that regulations. We would like also to see the policy coherence, identifying the regulatory overlaps and clarity gaps, and to see how we can make everything in line with each other. So for the result sides, I would like to offer it to Dana.
Thank you, Ariando, for the opportunity. And let me continue our presentation. So, first of all, when we talk about the digital ecosystem in Indonesia, as Yando said before, it is conducting in rapid situation. So each ministry has its own data system. But the main question is, what is the main references to build this digital ecosystem? So lately in Indonesia, we know that the government introduced the new policy, or we call it in Indonesia as SPBE, or the Digital Electronic Government System. And the systems becomes their main reference to build or to develop the data system in Indonesia, because it offers the same basic principle, requirements, and the access sector references. This is also includes the data standards, because they want to make its system is interoperable to each other. So they have also introduced the same data standards. But however, ideally, this scheme is also have to be implemented in every sectors, but in reality, it's not always implemented well, especially in the CRVS ecosystem, where each ministries that is involved in CRVS system, they have their own authority to maintain their own data. And for example, like we present to you in the presentation, lately in Indonesia, the Ministry of Home Affairs that manage the CRVS data, they have like a collaboration agreement with the Ministry of Health to exchange birth data. But however, they don't use the infrastructure that have been introduced by the SPBE system. So they have conducted the data exchange in manual and also in different mechanism with the SPBE mechanism. And yeah, this has also become our highlight, because when we talk about the data flow in Indonesia, as I said before, that the infrastructure is not, the architecture is not using the same architecture, even though the SPBE has over the same framework, but the CRVS system is not using that national framework yet. And the data standard, even though the national framework, they offer the same data standard, but again, in reality, we found that there is an inconsistent concept, variation in data elements, and the data structure, and also the categorization. So this creates a high redundancy risk. And the data sharing, actually the SPBE system has offered like the infrastructure for its ministry to exchange their data through interoperability services, but it's not implemented in what we found, especially when we give you a sample about the collaboration between the Ministry of Home Affairs and the Ministry of Health to exchange birth data. So it's not implemented yet. And the third one, when we also see the regulation, there's also an issue in the authority of its ministry, because its ministry that collects the vital event data, they have their own authority to manage their own system, but there is no regulation that mandates the data interoperability within the CRVS system, and the leadership is distributed across this institution, and the coordinated mechanism remains limited and insufficient because it's often conducted in informal or in project-based manner. And we also see that there are opportunities that happen in Indonesia because right now we also have the centralized population database that already exists under the Ministry of Home Affairs called the Population Database or SIAC. And right now our government also offers the new policy to mainstream all of the public services using digital governance systems, and also the SPB and SDE, or we call it as one data policy in Indonesia, is being mainstreaming and ready to be utilized. But in terms of this, we also see that there is improvement regarding to make sure that the ministries that works in CRVS ecosystem is collaborated to each other. For example, lately the Ministry of Home Affairs, they have initiative to support a pilot initiative to digitalize the social protection program led by the National Economic Council, which has used the CR data to support the social assistance beneficiaries. And however, to ensure this initiative is conducted in sustainable manner, we would like also to acknowledge there is some challenge that has to be overcome before we build a sustainable form of CRVS system. For example, the overlapping mandate that we mentioned before, and then how we can use the SPB platform to support the CRVS improvement, and also to make sure that its institution in CRVS, they know their own roles, their own knowledge, who is the leadership, who hold the leadership, who make the budget priorities and the protocol itself. So the development of the digital ecosystem that is used to build public services must use CRVS data to as a backbone to drive inclusive, evidence-based development across all sectors. And to build this, to achieve this, we think that we need to build a more specific regulation in Indonesia, so the CRVS ecosystem can be improved. In terms of, first of all, there is a mandate that really provide clear leadership roles and responsibilities, and then it is also have to overcome the data standards to harmonize the data definition, classification, and address structure across ministry to eliminate redundancy and to create a more permanent and sustainable coordination within the CRVS ecosystem. I think that's all for us. Thank you.
Thank you so much for that very interesting presentation, which I think just highlights how the technology can move ahead, but sometimes the regulations are left behind and need to catch up. So we do have a few minutes for any questions, any burning questions to our Indonesian presenters. Oh, yeah, we've got one from the panel. Please go ahead.
Hello. I have a question. As a fellow Asian country, as ASEAN country, may we ask how Indonesia manages data security and privacy in its CRVS system, particularly in terms of access control and protection against data breaches?
Okay, thank you for your question. So in Indonesia, Ministry of Home Affairs, especially the Civil Registration Office, has its own law for data use. In Ministry of Home Affairs Regulations number 17/2024, and also we have our own law on privacy and data security in Indonesia. So all in all, Indonesia also has its own cybersecurity and cybersecurity bureau that most of the countries' data security is will be consulted to. So all of the technical details on the data security and privacy are going to be consulted with them. So everything will be safely guarded. But of course, breach is happening everywhere. But we want to make sure that data security can always be breached, but we need to always improve ourselves, but also not limiting the usage of the data, because we are always too afraid of about the security risk. The risk is always there, but we need to ensure the data is also useful, and also ensuring that there is a data security in place. Yeah, thank you.
Thank you very much. So if you do have any more questions, remember them, write them down, and we will try to make time at the end because we still have 2 more presentations to go. We did say it's a packed session. So now we're going to go to a very federalized system. We're going to India, where the system really is operating at the state level, and we will hear from the systematic assessments to identify CRVS system bottlenecks in Bihar, in the state of Bihar in India. And this is a recorded message, so let's see if this will play.
Good afternoon.
Good.
At the outset, I would like to thank UNESCAP for providing me the opportunity to make the presentation in this August CRVS Forum. I would also like to thank my I would also like to thank my colleagues at the Directorate of Economics and Statistics, Department of Planning and Development, Government of Bihar, and UNESCAP, UNICEF to support me in carrying out the project. Despite substantial progress, the Government of Bihar recognized that achieving complete, timely, and accurate registration of birth and death requires sustained institutional reforms and improved operational efficiency. This priority aligns with India's commitments under SDG 16.9 and the ASEAN and Pacific CRVS decade, that is 2015 to 2024. With technical support from SCAP and UNICEF, Government of Bihar undertook a systematic and time-bound assessment of the CRVS system to identify gaps and inform targeted improvements directly contributing to action area of the regional action framework of CRVS in Asia and Pacific. This paper documents a real-world case study of how a participatory assessment, analysis, and redesign, that is AAR, of birth and death registration process identified access-related bottlenecks linked to registrar centralization and how the findings informed a state policy decision to reinstate Panchayat Secretary and initiate statewide capacity building. This assessment represents the first application of the updated CRVS system improvement framework, including the newly introduced 11 strategy outcomes AAR process allowed a participatory approach through 2 workshops that engaged field-level civil registration personnel from across the state. A core component of assessment was the development of business process maps of documents in registration workflow. Introductory and as-is workshop. The workshop aimed to orient participants on the guiding principle of a CRVS system improvement framework and familiarize them with the use of its 2 key tools, business process mapping and CRVS system analysis and redesign tool. Field validation. The core team formed for this assessment reviewed the inputs from as-is workshop, and as part of this analysis, field level validation of the identified bottlenecks and root causes was undertaken by the local consultant engaged on the project. The desired workshop in inputs gathered from participants during the introductory and as-is workshop together with the findings from the field validation visit were used to revise and refine the as-is process description, process maps, and relevant sections of the CRVS SAR tool in preparation for the as-desired workshop. Registration units are frequently located far from rural households, requiring long travel and in many cases repeated visit, often resulting in income loss and reduced incentive to complete registration. Although families frequently report birth and death within the 21 days legal time frame, consistent procedure and internal efficiencies at registration unit continue to cause processing delay. Inconsistent practice at registration units such as request for additional documents, unavailability of standard registration forms, leading to out-of-pocket expense to obtain them through unofficial channels, unwarranted penalties and procedure not required by law, create barriers to timely and equitable registration. A high proportion of institutional births are not registered due to unclear protocols, weak accountability, and lack of digital integration. Human resource shortage, uneven staffing, and skill gaps lead to delays and inefficiencies. Lack of an efficient monitoring and evaluation system which produce real-time analytics on service performance, data quality, operational efficiency, or client satisfaction. Supervision tends to be ad hoc with no structured mechanism for routine feedback, accountability, or continuous improvement. The CRVS system in Bihar faces multiple challenges that affects both the efficiency and accessibility of registration services. The 2023 restructuring, which designated block statistical officer as the primary registrar for vital events occurring at home in rural area, has centralized the registration process. However, this shift had even inadvertently placed a greater burden on rural residents, many of whom now face long travel distance to reach registration centers. The recommendations arising from the assessment analysis and redesign process, which was led by government stakeholders, informed a series of significant actions that are already being implemented by the government of Bihar throughout the state. Reinstatement of Panchayat Secretary as registrars in rural area. By restoring the role of Panchayat Secretary as registrars, registration services are being brought closer to the community. This arrangement aligns with the core principle of moving information, not people, and offers a practical community-based solution to improve coverage, timeliness, and data quality. Development of a detailed training curriculum for a training of trainers for the district statistical officers. Conducted a training of trainers on 23rd September 2025 to familiarize registration officials with the RVD Act, relevant rules, and the online CRS portal. The training at the grassroots level are in progress. Government of Bihar has initiated process of recruiting Panchayat secretaries for fill vacant positions. Similar effort was observed in the developed southern state of Kerala, where there is a strong Panchayati Raj system exists. The main aim of the assessment was to inform recommendation to improve the accuracy, timeliness, and completeness of birth and death registration in Bihar. One key finding was that accessibility and timely registration remain a particular challenge for birth and death occurring at home in rural area. In response, the government of Bihar reinstated Panchayat Secretary as registrars and is working to formalize the involvement of Anganwadi workers to strengthen vital event notification and facilitate the reporting process. This assessment has laid the groundwork for measurable and sustainable CRVS system, strengthening, expanding coverage, improving completeness and timeliness of registration, bolstering data quality, enhancing service delivery, and supporting the regular production and dissemination of vital statistics. Although implementation of several key actions informed by the assessment recommendation is still underway, future analysis of civil registration data in Bihar combined with additional research is required to provide a clearer understanding of the impact of measures already implemented. Thank you very much.
Okay, thank you to Praveen. And I think it's great to see from quite high level work, now we're getting into some really nitty gritty system analysis right down to the registrar level. I understand that Praveen is actually online and able to take questions if anyone has any. Yeah, Stephen, please.
Thank you. Thank you so much. I've seen the assessment, the way your assessment is designed. It's it follows. It's like the process that is provided for by the API CRVS improvement framework, where we use the client-centric the process-centric approaches and the result-based approaches to CRVS improvement. I have seen that you mentioned of the client-centric approach, but I didn't see how we were dealing with the process-centric approach, dealing with business processes. Because in these processes, you could design very good system. But if you have not looked at the processes and you focus maybe on the client-centric approach without looking too much into the processes and addressing the process-centric challenges so that you can identify redesign ideas to be able to generate redesign ideas so that you can build a better system. Then in the process of implementation, in the process of redesigning the interventions, if you have not looked properly into the process area, you might end up building a system that sometimes doesn't respond to the needs of the population. I have not seen how you will be addressing the process-centric challenges. Thank you.
Okay, that's a challenging question. Let's see if Praveen is up to taking it and if the technology allows.
Okay, thank you.
Okay, works.
Actually, we are working on a guidance of Registrar General of India. And as law, act and rules provided by Registrar General of India, we implement the process in the field level. And in Bihar, we trying to reduce the process-centric challenges, and that way we in 2023 we introduced the new registrar like Panchayat Sachiv, which deals with home birth and death registration. And now we are working on a standard SOP, a standard operation procedure, to minimize the process-centric challenges and to issue the both birth and death certificates quite easily to the client. So we are now moving towards this. Okay, thank you.
Thank you.
Okay, thank you, Praveen. And I hope you'll stay online till the panel Q&A at the end. And anyone, if you do have any more burning questions, please remember them, write them down, because we do need to move on to our final presentation. We'll move over to Pakistan. And Mariam will talk about towards sustainable financing, financial bottlenecks in Pakistan CRVS system. So Mariam, you have the floor.
So good evening, good afternoon, everyone. I think I have the toughest job now to keep everyone in the room awake and engaged with the presentation. So the work I will be presenting, it is based on a research work. It is a little bit different from what you have heard from the other presenters. I think probably more similar to what Rwanda presented about the system and the financing for CRVS in the country. I would like to acknowledge the co-authors for this work, Faiza Bashir, Nigat Murad, Ali Rahman, Mumtaz Khan, Zainab Samad, and Chalapati Rao. We had funding for doing this work through the Gates Foundation. So basically a little bit about the work which was funded. So we piloted work for establishing the sample registration system in the country. And while doing that, we had to do a landscape analysis of how the current funding is for CRVS and what can be the potential areas to tap into for future funding for sustaining and integrating the SRS system, the sample registration system within the country. So while doing that, while mapping all the funding, it came across that we need to actually look at the CRVS structure and its financing within the country to be able to pick at and pinpoint what are the areas which would be useful in future years to establish the SRS. So I'll explain a little bit about how the country's birth and death and migration, immigration, marriage, divorce system works, and focus mainly on the birth and death registration, like you have heard from, I think, Indonesia and from Philippines as well. We have a very sort of a complex multi-sectoral framework in place right now. The system gets the notifications for births and deaths from two different channels. One is from the health or the hospitals, and the other is from the community-based, where if the birth or the death has happened in the community, that's where the families go and register through their union council offices to support that work. Now, in doing so, the interoperability, which you have heard from Indonesia, is again fragmented and fractured across the country. We have a decentralized form of government. So we have 4 provinces, which are quite large, and we have 2 regions, federally administered regions as well. But health remains their own health, and these reporting remain their own subject. So their systems are variable. Some are advanced and well connected with the database which records all these information, and the others are still struggling to make them meet and make them match. So the interoperability is variable. Now, because of, it's not that the registration system was not there in the country. It has been there for decades. But the birth and death registrations have remained persistently low. It was only during the COVID times that things sort of improved, and they did mainly so for the death registration, because at that time, all the mortalities, the burial grounds, they were mandated to take a COVID certificate from the hospitals before the burial could happen. So that's when the community-based deaths also started getting registered, and people had an awareness of where to go and how to register the death. The birth registrations have picked up, but mainly, you might have heard in one of the morning sessions, it's mainly for political reasons, because the number of people in a province then determines the number of seats in the National Assembly, and that's where the politicians and the reason this whole thing is complicated is because the politicization of it as well. So there is a lot of focus on birth registration, but that remains highly focused to hospitals at the moment. And the reason that community-based birth and death registration is low is mainly because of low awareness at the community level. People are just not aware of why they should register a birth or why they should register a death. I've not given a breakup here of the death registration by gender, but if you have a look, the disaggregated figures show that it is low in rural areas and it is low for female deaths, mainly because the inheritance, it goes through the male line. So the female death is only registered if she has some inheritance work to be done. So that's when that is registered. Otherwise, female deaths are not registered. So the information or the results which I will present are based on an extensive review of, so since I was supposed to look at the funding available or the financing of how the whole CRVS system is getting in the country. So I kind of, we did a qualitative analysis based on the budget documents, on the national strategic documents, on the donor project portfolios. We did some informal interviews as well with some key persons in the finance ministry, in the interior, in the planning, and in health, to get a sense of what the information is on paper and to have a better understanding and the explanation for writing it down in the paper, which again is published on the forum's website and can give you a better detail. So we also looked at sort of a time motion. We did a time motion valuation to see how long the donor-funded projects funds last, because they don't last forever. They have an expiry time. So there are certain things which are done during those years. So we looked at that. We also tried to quantify the in-kind work put in by the human resources. And this included right from the community-based lady health worker or the female community health workers up to the offices at the Union Council and the doctors or some other persons entering the death and birth registration, data at hospitals or the Union Council level. Based on this, we developed So we sort of developed, identified how much of funding was there, and this is for last 2 years. It's not it doesn't go back very long. It's just for 2 years. I'll just quickly walk you through this ribbon sort of a diagram. So the total pooled fund was identified to be 272.5 million USDs, but this wasn't exclusively for CRVS. It was for a lot of health system and other strengthening initiatives that included the birth and death registration as well. This included large donor-funded projects like through World Bank, through UN organizations, especially UNICEF, and in Pakistan has been supporting the CRVS work for quite a long time. The World Bank is both a loan and a grant, and it's the project is called the National Health Support Program, NHSP, and they also have the Pakistan Human Capital Investment Program going on. I think both of them are due to expire in the next couple of years. So the funds from these sort of projects which supported the CRVS infrastructure and trainings and capacity building initiatives and sort of getting up the basic infrastructure improved and enhanced. The domestic funding through annual development plans was $80 million. And this was for both federal. Like I said, we have a decentralized system. So some funds are from federal, and then provinces have their own budgetary allocations to use and allocate for the operations. But you can see that from the domestic, about 29% goes into salaries and not much. The in-kind contributions were huge. They are documented in the paper. I'm sorry, I think I didn't have a lot of slides really to get that here. But the key finding was, so now we have in some provinces, we have all the technology available there. And we have the human resources trained for entering the data, for giving the information out, but the infrastructure just stops working when the funding ends. So people are just, I personally went and saw a lot of computers, tablets, which were supposed to be for the project. They were used during the project, but then once the project support ended, the HR went away or the HR's incentive went away, they stopped using it to enter the data. And this work was developed jointly with NADRA, which is the database which registers the births and deaths. And they had actually identified it, indicated it, and said, well, we gave everything, we gave the trainings, but now people are just not using it because there is no push or the drive. So there was a big mismatch in the capital and the operational expenses. and the hardware then needs to be updated. The maintenance costs are very high, and upgradation costs are very high when they are transferred to the government or to the health department or the interior department. So the primary bottleneck was not the technology, but it was the fragmented financing and the incentivization which came with short-term plans. There are several district pilots, but they all have a lifespan of 3 to 4 years. They end after that. Then, we found out that it's, and you've heard as well that it's not unique to Pakistan. It's unique. It's everywhere, not just in the neighboring countries, but also in the African countries. The long-term viability, it requires transition from fragmented projects. So this is the funded expenditure is going into biometrics, into the database management, into digital dashboards, and into one-off capacity building workshops. There are no refreshers as well. Then the unfunded, it's the office space, it's the internet expenses, because that needs to be there. Then local transport for registrars to actually go and validate the deaths or the births, the maintenance of the hardware and the stationery which is required. Right. So the recommendations which came out, which we are working with the government, is to have a steering committee with all concerned, because right now the management of the CRVS is also fragmented. There is the Ministry of Interior, there is the Health Department, then there is the Overseas Employment Department who look at the migration, immigration, and then there is a bureau which looks at the marriages and I think it's the Islamic Ideology Council or something, which looks at or maintains registers of marriages and divorces. So there has to be some statutory body and a clear leadership who brings them all together, because even now for doing this work, I had to identify people individually, institutionalize the training of the HR as pre-service, not as in-service. And the in-service, there should be certification or refreshers or relicensure, assessment at relicensure, mandating some part of funding to the government expenses before the project ends, because that's where the gap is. The projects come, but the local government or the local national financing system is just not picking up the bill. Enforcing some equity formula, we have, like I said, we have variability in terms of the provinces as well. Some are advanced and some are not so advanced. So pushing the funds there, making sure that they also have equal investments from donors and from the government, that should be pushed. Private sector, we have a thriving private sector. 70% of people are going to a private healthcare provider for their needs, but they're not linked to the national health databases. Disaggregated verbal autopsy and ICD training costs. This is not part of the training yet. And then data security, that's one of the biggest concerns. And then there have been breaches as well. So, I am finishing on time. So thank you very much for your attention.
Thank you very much. And it was good to have, I think, wrapping up this session, a look at who's paying for the system reforms and how should that itself be reformed. So we've come now to the question and answer time for the panel. And this is where, if you've had any questions that you've been saving up while they've been presenting and didn't get a chance to say, then this is your opportunity. Ideally, if you have questions for all the panel, that would be great. If not, then do say to whom you're addressing your question. And I think, Alfina, did you raise your hand? Okay, you were first, so over to Alfina.
Thank you, Petra. Hello, my name is Alfina from Indonesia. I would like a question to Pakistan. So thank you so much for your insightful presentations. So I'm curious, have you also looked or maybe assessed how much investment would be needed to address these bottlenecks, and what the strategies are being considered to reduce reliance on the external donors, so to ensure more sustainable, and maybe Pakistan will use the budget finance from Pakistan. Thank you.
Yeah, thank you very much. So this was, like I said, this is a research work, and this was first part of it. Since we got so much information from just the landscape, preliminary, qualitative, and a landscape, the second part is exactly what you were saying. We are right now engaging with the key stakeholders. We have onboarded them about what the issues are. We are in conversation with the finance ministry of the country, together with both the interior and the health, to identify exactly how much is needed in the next 5 years to move the pin from less 40% to at least 60%. We're not aiming very high. That's what we were told. We wanted 80% coverage of birth registration, but we were told that we have to be realistic in terms of the size of the country and the population which needs to be covered, and the how much in depth we have to go to the communities, and how much in depth the country has to actually invest. So for that we are working. Maybe in the next year's forum I might be presenting that as to what is the exact label or the cost which the government has to pick up, and what areas they can support. But the key areas we have identified for them, one is the improving the pre-service curricula. That's a very sort of a minimal cost thing, including it in all the healthcare cadres and the registrars. It's just a 1 to 2 day module, which is already worked on. So that's a low cost thing. Then refresher trainings, some upgradation of equipment. The biggest cost that is coming up right now is the incentives or having exclusive HR. So that's the biggest cost head, which so far we have been able to identify. That's where our work is right now. Thank you.
Thank you, Mariam. And I nearly choked when you turned this into an annual event. The last one was 3 years ago. Okay, any other questions from the floor? Yeah, Maya?
Yeah, thank you. And thank you and congratulations to all the presenters. I'm Maya from Sri Lanka. My question goes to Stephen from Rwanda. Actually, I'm interested to know, I have heard that your system has a good set of dashboards. So I'm interested to know what are the usage, what are the applications you have been doing, and what are the users of that for the future policy make decisions you have taken with these dashboards. And also, I want to know about the monitoring and evaluation system, involved with your CRVS system. Thank you.
I think before you answer, let me just get a feel for how many more questions there are in the room. Yes, Subin, and anyone else got any questions? All right, we've got a few, and we don't have much time. All right, maybe Subin will take your question, and then we'll open for one more round of 2 or 3 questions, and then I think we'd have to wrap it up. So Subin, what's your question?
I was about to ask 2 questions, but maybe I'll just ask one. And was hoping to ask this to all the presenters, but maybe presenters from Philippines and Rwanda could answer this. CRVS systems, you talked about inclusivity as well, and also realize that, I guess, going through your papers as well, that the CRVS systems, the digitization of it still excludes undocumented or stateless people. So wanted to, know if there were concrete plans to include stateless people in the CRVS systems as well, especially for those 2 countries, because they've made pledges to address statelessness. They have national action plans to address statelessness as well. So that was, I think I'll probably stop there.
Okay, great. Thank you. And actually, that was a question I was going to ask as a moderator's prerogative. So I'm glad that you asked that question. So, Stephen, one question to you. And then I think the question on inclusivity and digitalization, really to any of the presenters who would like to answer it.
Thank you. About the dashboards and data use, again, this is a process. So with all this period, we've been bringing out the output. But what about the outcome? Because yes, we have the data, birth registration, we can present data, we can present achievements, and so what? So that's where we are now. We are looking at, now that we are almost near universal birth registration, we want to see how does that translate into policies and so on. But within the meantime, the data has started to be used in education, in education planning, in health, by the Rwanda Biomedical Center, basing on the data that comes from civil registration. They are now able to know the levels, how many births have taken place, how can we plan from this immunization, but we are still at a very low stage. We want to see how the data translates into real concrete interventions. But we are just still starting. It's not yet something that we can say that we have achieved. We've been trying to see how to make sure that civil registration takes root, brings outcomes, rather outputs, but now we want to see the outcome part, which is data use and translation into the livelihoods of the population. We are not yet there. On the M&E, how would we do the M&E? Follow up on the registration rates. I think this is what you wanted to know. We've got the technical working group that handles the day-to-day CRVS operations. So at the beginning of every year, we have a CRVS joint action plan. And each stakeholder has got the activities, who is responsible for what, who is going to provide the budget for this activity, and how are we going to coordinate. So it's this plan that helps us do the monitoring throughout the year. Have we achieved this activity? Have we done this? When are we supposed to be doing this? Who is responsible? Who is going to take the lead? So that's how we monitor activities. It's through the National CRVS Action Plan that is normally developed at the start of the year. So how do we deal with undocumented residents or the stateless? So this is a challenge. We've been working with the Immigration Office. The Immigration Office is the one responsible for nationalities and the stateless. So we've been working with this. In fact, some days back, they conducted sort of a census to see who are those people who are not documented, who do not have documents. This is what I know. They have documented the people without documents, and within the framework of the single digital identity system that is being rolled out, no one in the Rwandan territory will be without a document. That's something that is being done now. Either the citizens, people from outside the country, the foreigners, the refugees, and the stateless will all be given documentation. So you don't need your card to have a label that you are Rwandan for you to access service. In any case, a service should be given to everyone on the territory. So this is what, driven by that understanding, within the framework of the single digital ID, all the sects of the population are going to be given the ID, and they are being identified. The process is now in the activity to enroll everyone on the territory is taking place currently. Yeah.
Would any of the other panelists like to answer the question on inclusivity?
Inclusivity from Indonesia, yeah. Okay. So in Indonesia, we also have regulation or policy to access or to improve the data on vulnerable group, especially from the Ministry of Home Affairs. But unfortunately, I think the stateless people, refugee, is not included yet. They are facilitated, but the government does not want to give the national ID for the refugees because they think they are not they are not participating in the refugee conventions. But we are working on that way. For example, like last month, I think the Statistic Indonesia also conducted a workshop regarding to migration data that includes also the stateless and refugee. But maybe we'll back to you when there is a new updated information on that. I think that's all for me. Thank you.
Okay, and would any of the other panelists want to address that?
Hello. In the Philippines, we have the every 5 years we have the census. Like we go in their houses to survey the population of the whole country. So right now we have the national ID, the PhilSys. So the goal of this my research in the integration of the PhilSys and the CRVS is to diminish or make the rate of this data. So we have that goal in the Philippines. So because the national ID has this identification system like the biometric system, so we can monitor all of the all of those people who registered in the CRVS system in the different places. So that's the goal of integrating this system to the CRVS system. Thank you.
Okay, thank you so much. I must apologize that in my role as moderator that we don't have time for another round of questions, however much we'd have loved to have continued. However, the good news is the conversations can continue. First of all, we have 2 more days and our panelists will all be here. You can also always find their contact details as well if you want to email them. But even more excitingly, we actually are going to continue our discussions in a social event that is happening now down at the Garden Cafe. So this is a chance to network and meet. And of course, I hope our panelists will stay because I'm sure that you'll be taken aside to be asked some of the questions that we didn't manage to get to in this session. So I think since the UN cutbacks mean that the lights and AC will probably go off very soon, we should definitely wrap up now. And while we still have electricity, I will take this opportunity to thank our fantastic panelists and the audience for such an engaging conversation. Thank you.